Hey everyone, welcome back to Bewitching Brain. We're so happy to have you with us and encourage you to subscribe and share. Take good care, be safe, and help others be safe. In the last video, we introduced spinal cord anatomy and function. In this video, we'll be talking about the cross-sectional anatomy of the spinal cord, as well as reviewing the two main sensory pathways going from peripheral nerves up the spinal cord and to the brain for processing. So let's start with the cross-sectional anatomy of the spinal cord. To understand what a cross-section is, imagine you slice a hard-boiled egg. Depending on where and which direction you slice, the cross-section will appear different. Similarly, horizontal slicing of the spinal cord at different levels yields different sections. We won't talk about the differences between cervical, thoracic, and lumbar cross-sections today, but just bear in mind that they do vary. Here's a generic cross-section of the spinal cord. First, note the dorsal horn, which transmits sensory information, as well as the ventral horn, which transmits motor information. Next, take a look at the dorsal column, which, as we talked about in previous videos, transmits touch, vibration, and proprioception information from sensory neurons to the brain. The dorsal column is composed of ascending white matter tracts. There are two ascending white matter tracts, the fasciculus gracilis and the fasciculus cuneatus. The fasciculus gracilis transmits sensory information from the lower body, including the legs. You can remember this by thinking of a graceful dancer. By contrast, the fasciculus cuneatus transmits sensory information from the upper body. Next, take a look at the ventral white matter tracts. These are located next to the ventral horn. The lateral spinothalamic tract and the anterior spinothalamic tract transmit pain and temperature information. The next few slides in this video will review the dorsal column as well as the anterolateral systems. So let's start with the dorsal column and medial lemniscus system. Recall that neuron number 1 is the peripheral sensory nerve traveling from the sensory receptors. It then enters the dorsal root ganglion, or DRG, travels to the dorsal horn, and exits the dorsal horn to ascend within the white matter dorsal column. If the sensory receptor is in the upper body, neuron number 1 will travel within the fasciculus cuneatus. If it's in the lower body, neuron 1 will travel within the fasciculus gracilis. Neuron number 1 ends in the brainstem on the same side it entered on. Neuron number 1 synapses with neuron number 2 within the fasciculus gracilis or cuneatus in the brainstem. Neuron number 2 then crosses to the other side of the brainstem and ascends as the medial lemniscus. Neuron number 2 ends in the thalamus. Neuron number 3 travels from the thalamus in the brain to the somatosensory cortex. This allows processing of the sensory stimulus. So let's move on now to the anterolateral system. When a pain or temperature sensory receptor fires, the signal travels along a sensory neuron into the dorsal root ganglion and ends in the dorsal horn. Neuron number 1 synapses with neuron number 2 within the dorsal horn. Neuron number 2 then crosses over to either the lateral or anterior spinothalamic tract and ascends within that tract. Neuron number 2 ends in the thalamus. As with the dorsal column system, neuron number 3 travels from the thalamus in the brain to the somatosensory cortex, allowing processing of the sensory stimulus. Once again, a huge thanks to Dr. Patitucci for her spinal cord illustrations. Next time, we will be discussing the motor tracts of the spinal cord. Thanks for listening, Brainiacs, and tune in next time for more.